The following program and contents, including the views and opinions expressed by the host and any guest speakers, are solely for informational and entertainment purposes. The views and opinions expressed are not endorsed or supported by Relmar McConnell Media Company, the X Zone Broadcast Network, their employees, affiliates, or advertisers. The host and guest speakers are solely responsible for their own perspectives, and their views do not reflect those of Relmar McConnell Media Company, the X Zone Broadcast Network, their employees, affiliates, or advertisers. The information provided in this program should not be considered as professional advice or as a substitute for professional consultation. Listeners and viewers are encouraged to form their own opinions and seek independent advice when necessary. Relmar McConnell Media Company, the X Zone Broadcast Network, their employees, affiliates, and advertisers hereby disclaim any liability for any claims, damages, or losses incurred as a result of the information presented in this program.
Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Thanks for joining us. Mission Evolution Radio TV show is coming to you on the X Zone Broadcast Network and X Zone TV channel, divisions of Relmar McConnell Media Company, with their studios in corporate offices in St. Catharines, Ontario, Canada. Drug it out, cut it out. Is there a third option for pain? Many of us deal with chronic pain of one sort or another. Those of us that do know that pain can be a pain to handle. With us this hour to explore some possible alternatives in pain management is Dr. William Pawluk. Dr. Pawluk is a formerly board-certified family physician who's had academic appointments at a number of universities, including Johns Hopkins and the University of Maryland. He's had training in acupuncture, homeopathy, hypnosis, and bodywork. Dr. Pawluk is considered the foremost authority on the use of pulsed electromagnetic field therapy in North America. He's the author of Power Tools for Health and Supercharge Your Health with PEMF Therapy. His website, drpawluk.com. Dr. Pawluk, thanks so much for joining us on Mission Evolution.
Well, thank you very much, Wilda, for having me, and I look forward to sharing with your big audience. Thank you.
Well, it's nice to have you here, sir. Let's start out with your bio describes you as a formerly board-certified family physician. Are you still in practice?
No, I retired about 2 years ago. I had a holistic practice in the Baltimore area, and now basically all I do is focus on magnetic field consultations. So I advise people on how to look at PEMF therapies. I'm writing considerably, lots of ebooks, and besides those 2 books that you mentioned. So I'm keeping busy, but I'm not practicing anymore.
So you were a general practitioner?
I started out as a family physician slash GP, but I was board certified in family medicine in the US and Canada. I did that for many years. For about 20 years ago, I basically converted, if you will, using that term, converted over to holistic medicine. So I did that for about 20 years, and then I retired recently.
What do you consider holistic medicine?
Basically, holistic medicine is considering the whole person, but it's looking at the entire tool chest of possibilities to help somebody. So as you mentioned in the rundown of the different things that I've learned, uh, I added acupuncture to my tool chest. I added hypnosis to my tool chest. In other words, mind body medicine, essentially. Then I added healing technologies because people would go to healers and get some very significant benefits. So I thought, what is going on with healing? So let me try that too. So basically, as many things as I could learn, because everything that you do has limitations, and everything you do still there are lots of things that it doesn't do. So the more tools you have in your chest, the better. So I consider that holistic, but you're considering the whole person, their psyche,
Okay.
their mind, body, their spirituality. All of those are all connected.
That makes perfect sense. So how'd you start focusing on chronic pain?
Well, chronic pain, when you're a primary care doctor or a family physician or even holistic medicine, everybody's got pain. I don't know anybody who doesn't have pain. And if you didn't have pain, you're probably dead anyway.
So do you think that our society and the automobiles, I mean, who do you know that has not been in an automobile accident? And, all the damage doesn't show, but a lot of people end up in chronic pain after that. Do you think that that's why we're seeing so much chronic pain in our society?
Well, there's lots of reasons for chronic pain. A lot of it has to do with nutrition. It has to do with the state of the body at the time of any kind of injury. But you could have chronic pain from autoimmune diseases. You could have chronic pain from a head injury. You could have chronic pain from stroke. There's so many different causes of chronic pain. Virtually every organ has pain receptors, so virtually every organ can produce pain. So it doesn't take a whole lot to produce pain.
So, in our toolkit of the normal physician, Western medicine, how do we what are our choices to treat chronic pain with?
So this kind of goes back to why I started doing magnetic field therapies. So back in the 80s, I was part of a medical director for a group of family physicians. Actually, it's the biggest family medicine group on the whole East Coast of the US. And we shared patients. We rounded on in the hospital on our patients, common group rounding. And we had, in a space of a week or so, 2 weeks, we had about 3 patients come into the hospital with gastric bleeding, with GI bleeding. And one of them almost died. Two
Oh
of them were
my.
very sick. And so the commonality to all three of those individuals was gastric bleeding, was ibuprofen or
Oof.
non-steroidal anti-inflammatories. So that's a common, very even today. And now, of course, you can buy ibuprofen over the counter. And how many people are using ibuprofen in excess of what their body should do? If you're getting a prescription from a doctor, at least there's some degree of control over how much you're taking. But because of that, I said, well, this is crazy medicine. They were almost killing people to manage their pain. The pain's not killing them, but we're almost killing people with the treatment. So that's how I decided to study acupuncture. So, well, there's got to be another alternative, and that's why I went to acupuncture.
Well, we're in the middle of an opioid epidemic as well. Have you witnessed some of that?
Oh, totally. Given my length of history in practicing medicine, when I had those patients almost dying from ibuprofen GI bleeding, we weren't allowed as much. And doctors were very, very restricted in what they could do, personally restricted, what they would do in terms of using opioids. And so that was like a last resort, using the opioids. Then the government and all kinds of advocacy groups and so on said nobody should suffer. Nobody should not have pain. We should be able to have everybody totally pain free. Well, that released the floodgates basically on the use of opioids. So this is back in the early 2000s, essentially. So a lot of it was facilitated and promoted by our own federal agencies. And so as a result, opioid use increased dramatically and became okay to do that. Well, that you could see it coming. There's an opioid epidemic. So now people will leave the hospital after a dental procedure, for example, or relatively minor hospital procedure, and they'll get 10 or 20 days worth of OxyContin prescription,
Oof.
right? Because the doctors were encouraged to prescribe opioids, essentially, or painkillers. So that's why one of the reasons there's an epidemic. There's other reasons for epidemics too. People start to gravitate to using painkillers on their own, like fentanyl or other opioids, etc., which they could buy on the street, because they are not having their pain managed adequately, and so that also leads to the epidemic.
Right, right. Well, it's a tangled weave, isn't it?
Very tangled,
Yeah.
and
So,
my job is to untangle it.
well, it's sad because there's not really very many good options out there for people that have been in a car wreck or whatever and are in chronic pain. So, um, speaking of which, what are PEMFs?
Okay, PEMF stands for Pulsed Electromagnetic Fields. So it's a magnetic field that's essentially pulsing into your body. And that magnetic field pulses into the body, and as it passes into the body, it creates all kinds of charge improvement in the body. So it increases the amount of energy available to the body.
Well, let me stop you for just a second. Are these something naturally existing that help?
Fundamentally, no. So people talk about earthing, and so earthing, like walking on the earth or hugging a tree, is a way of getting energy from the planet itself. We in nature, we would be able to have access to that resource, if you will, but we find that resource is actually a very minimal benefit. Now, if you're exposed to it continuously, but people in the days when we were using that resource more, these are also days when people didn't live past their 40s. Right. So now we got civilization that's impacting us in all sorts of ways, all kinds of negative ways, but also all kinds of positive ways. So we do have more resources available today for pain management than we did back, let's say, at the turn of the 20th century.
So the PEMFs are not necessary. Well, they're naturally occurring, but not to the degree that we would need to have them have an effect.
All right. So fundamentally, PEMFs are a relatively recent development. They're natural in the sense that they create a natural reaction in the body. They're not natural in the sense that nature provides it. So nature does provide some degrees of EMFs, sunlight, all right, and motion. Actually, the motion of the body on the earth creates PEMFs within the body itself. Our earth is a huge magnet. And there are magnetic field lines that run north and south on the earth. And when you cross field lines, when you're in motion in those field lines, you're generating more energy in the body. But again, it's not enough, and it's not directed, and it's not consistent or reliable. So that means we have to look for sort of more synthetic or artificial sources of being able to produce those magnetic stimulation effects in the body. So we design then, magnetic fields are designed by devices that produce a voltage or a current. And that current passes into a wire. And this is where our dear friend Tesla comes in. So it was called the Tesla coil. So Tesla discovered that if you take a wire that's conducting current, and the current goes out and then it comes back. So they're going opposite to each other in the wire itself. But when you take that wire and you expand the wire, so current's flowing in and it's got a loop now, and then that loop comes back. Well, the expansion of that loop then allows a magnetic field to be produced.
Interesting.
Right.
Well,
And that magnetic field, even in a shielded wire, that magnetic field goes outside the wire. So it's no direct contact with the body in a sense.
well, we're going to have to pick up on more explanation as to this functioning of these PEMFs on the other side of a station break. Dr. Pawluk and I will return, so don't you go away. This is Mission Evolution, www.missionevolution.org.
Are you ready for a tale that will leave you on the edge of your seat? Get ready to dive into the gripping memoir by Bart Sibrel titled Moon Man. Bart Sibrel takes you on a heart-pounding journey, unmasking the truth behind America's famous Apollo missions. Prepare yourself for hair-raising encounters with agents from the U.S. government's top secret agencies. In Moon Man, Sibrel fearlessly reveals his real-life espionage adventures, shining a light on one of the CIA's best-kept secrets. Brace yourself for shocking revelations, including Sibrel's discovery of privately recorded audio exposing an Apollo astronaut's chilling plot, a plot orchestrated by the CIA. That's right. As Sabrail unveils this groundbreaking evidence, it becomes clear that there is much more to the Apollo missions than meets the eye. Could it be that we've been deceived all along? Moonman is a gripping page-turner that challenges everything you thought you knew. It's a mind-bending journey into the unknown, where the line between truth and fiction becomes blurred. Don't miss this opportunity to uncover the secrets hidden for decades. Let your curiosity guide you as you join Bart Sibrel on his quest to find the truth. Moonman, available now at Sibrel.com. That's Sibrel.com. Prepare to have your beliefs shaken to the very core.
Is there healing power in an electromagnetic field? With us this hour discussing the possible uses of pulse electromagnetic field therapy is Dr. William Pawluk. When we were going into the break, we just started discussing what PEMFs are and where one can find them as far as in naturally occurring. How do they relate to EMFs? EMFs have a bad rap, from causing children to have cancer because again the power lines go over the top of us, and the field goes outside of the power lines. How do the two of those differ?
They're very, very different, both in conception and in terms of action. The conception aspect of it is that they were created for communication purposes. They were not created with a human in mind, in the sense of, except for being able to talk to somebody on a cell phone or Wi-Fi, and so on. So they were created to be able to be broadcast, like radio waves, like AM or FM or TV signals, or even radar for that matter. So that they had a very different purpose, and they were designed to have extremely short wavelengths. And as short wavelengths, this is the sort of basis behind a microwave oven. Those very short wavelengths are absorbed by whatever you put in the oven, and it heats. So that's EMFs. Primarily, they're designed for a different purpose, and they can cause harm to the body because they're absorbed by the body, just like they're absorbed by whatever is in a microwave oven. So that's very high-powered, relatively speaking, high-powered microwaves, as opposed to what's out in the environment in general. But that, again, is a completely different aspect. It's not designed for therapy. PEMFs, pulsed electromagnetic fields, were designed primarily for therapeutic use, and they've been in existence for over 50 years. One of my first books that we didn't discuss was called Magnetic Field Therapy in Eastern Europe, a review of 30 years of research.
Now let me back you up just a little bit. You said they didn't exist, but you also said they were naturally occurring.
Well, they're naturally acting, but they're not naturally occurring.
Okay.
All right.
So you have to generate them.
You have to generate them. Now,
Okay.
They're naturally occurring in the sense that I mentioned the Earth's magnetic field lines. If you're crossing them and you're in motion in those field lines, you're generating charge or magnetic field therapy in the body. Our whole existence totally relies on us living, being born, living, and dying on the planet inside a huge magnetic field.
Okay, let's break that down a little bit too. Recently, I know they've done a lot of studies on the electromagnetic field that surrounds the body that's generated predominantly by the heart, but also by the brain, because there's motion going on there. How do those differ?
Okay, so our body, all chemical reactions, all reactions in the body are actually physics reactions. They're not just chemical reactions. In other words, physics doesn't allow salt to merge with chloride to form salt, right? Physics has to allow that, even though it's a biochemical or a chemical reaction. Physics has to allow it. So physics is what governs everything that happens in our bodies. And when we're moving in a magnetic field, we're creating charge. Now, that charge is interacting with the charges that are naturally produced by all the motions and activities in the body. The heart is the most electrically active organ. It's pumping constantly from birth to death, right? And the brain, of course, produces a lot of electrical activity too. So we now have devices that can measure brain magnetic activity and measure cardiac magnetic activity. The measurements for the brain are now being used, magnetic field measurements for the brain are now being used to map seizures in the brain. And based on that mapping, then surgeons know where exactly to cut, because you want to limit the amount of damage in the brain. You don't want to be sort of fishing around in the brain with a knife, right? You want to be doing it right where you, at the very spot that you need. So that's the body's natural production. The rule of thumb is in physics, magnetic fields interact with magnetic fields. Magnetic fields interact with electrical fields. That's why we call it electromagnetic. You can't separate the two. Wherever you have electrical activity, and in our body, we're full of electrical activity. It's not just about the brain or the heart. All the ions that are in motion in the body are actually creating electrical charges. So our body is not saline. We call the body water, basically saline. It's not really saline. It's electrolyte soup. There are all kinds of electrolytes in it, and they're constantly in motion. And so they produce tiny, tiny, tiny magnetic fields. So when you pass a magnetic field through that environment, it amps up the energy that that environment is producing. And that's part of why magnetic fields can be so helpful in terms of healing.
So the magnetic fields that occur naturally in the body by the means that you just described are not necessarily PEMFs.
Well, in a sense, they are. There's two basic kinds of magnetic fields. Forget putting aside EMFs that we discussed. There's two kinds of magnetic fields. There's the static magnetic field. And that one we know of by having a magnet on the fridge. That's a static, or a bar magnet or a horseshoe magnet. We know those magnets. We understand them. So there's almost nothing in the body that will produce a static magnetic field because nothing in the body is not moving. Right? It's all chemicals, it's all atoms and molecules that are constantly in motion. So the body is producing movement, what we call alternating magnetic fields, or we also call it time varying magnetic fields. So time varying is the key term. So in other words, a static magnetic field is not moving in time. A pulse magnetic field is moving in time. So that's time varying. So the body is producing all kinds of time varying magnetic fields, but I wouldn't necessarily classify them as pulse because they're not necessarily pulsing in a very specific way, in a very directed way, with the right kinds of intensity and the right pulsations to be able to drive healing work in the body.
So you're saying there's a natural PEMF in the
Within the
body,
body,
but when you're working with the PEMFs for healing, you are manipulating them in such a way as to correct imbalances in the EMF or the PEMF field in the body.
or in the biochemical reactions of the body.
Okay.
So we put aside the EMF aspect of that. It's just the physics or the energetic involvement with the biochemical processes that already exist. So they already exist in the body. What we're doing is we're amping it up. We're giving the body more energy. One of the aspects of magnetic field activity in the body is to produce ATP. So ATP is the energy molecule of the body. Well, magnetic fields interact with the cells and the mitochondria inside the cells. It's the mitochondria inside the cells that make the ATP. Well, magnetic fields activate the production of ATP. So they're producing energy. But they're also making all these biochemical reactions more energetic because now the body has more energy to do all of that activity.
So let's pull EMFs back in for a minute.
Right.
And do the EMFs interfere with that process in the body? Is that part of why they're damaging?
They interfere with the body's natural processes because they're producing a magnetic field energy that is causing heat. And the heat causes DNA damage, it causes cellular damage, it causes damage to the cell. We know of EMF in a sense by having a sunburn. That's essentially a form of EMF. It's very short wavelengths, highly intense, and then we expose ourselves to that kind of EMF, then we're causing a sunburn. So that causes damage. So putting that aside, then basically what we're trying to do is to create a controlled reaction in the body by having essentially larger or longer wavelengths. Pulse magnetic fields don't really have wavelengths per se.
What do they have?
Aha, good question. All right, that's a very important question because that's a big part of the distinction between the damaging effects of the body. What they have is they basically, my thumb is a wire. Let's say my thumb is a wire. And let's say that thumb, the current is conducting a current in that wire. So this is the direction of the wire. And when there's current flowing in a wire, it automatically produces a magnetic field perpendicular to that flow of current. This is a well-established physics law. Maxwell's laws, Maxwell's equations. So the magnetic field goes like this. So every time the current pulses, a magnetic field is produced, and it goes out and collapses back on itself. That's another distinction between EMFs and PEMFs. EMFs go on forever. They broadcast out into the environment. PEMFs are controlled by the wire and the current flowing in it. So as the current flows through the wire, it pulses. And as it pulses out, it goes into the body, pulses back, collapses. So it's called a closed loop. So that pulsation, magnetic field pulsing into the body, goes into the body and then comes back. So that's a directed sort of pulsation into the body of that field.
So while we're manipulating PEMFs, is there a point at which they become damaging?
No, fundamentally, most PEMF systems are not designed. They're designed to be safe. So EMFs are not. In fact, you can design EMFs just like with microwaves to burn tissue, and they're used in medicine for that purpose. In fact, and they're called radio frequency. So radio frequency is the same as microwaves. So EMFs are extremely low pulse rates compared to microwaves, which are chattering. These are slow, much slower waves. Because they're slower, they don't really cause harm. Now, can you do too much too fast? Absolutely. And
What
so
happens when you do?
well, all kinds of reactions can happen. The thing is that magnetic field therapy in that sense is basically like athletic training. You don't get off a couch and run a marathon tomorrow. You have to train for it. Well, magnetic fields are pushing the cells and pushing the tissues of the body, and the processes and the energy in the body is being pushed to do more.
Does
So
that cause additional toxins to be dealt with at first?
it may cause an increased reaction of aggravations or detoxification. So detoxification may be a part of the problem. So I advocate a process called going low and slow. You have to know your magnetic field. You have to know what you're dealing with in the body. You have to sort of understand your own state, how healthy you are, how robust you are. So a 300-pound linebacker playing professional football is generally going to be in much better shape than a 70-year-old who's had all kinds of health issues, including cancer and diabetes and autoimmune diseases. Well, they're starting at a point where they're much more vulnerable in terms of being pushed to do more. Right? Healthy people can stand all that stuff, and in fact, they say, "Suck it to me, suck it to me."
Okay, so the people that aren't quite so healthy, there's a lot more repair to do, and so you have to start more gently.
More gently. It
Okay.
may take more time, may take less energy.
Well, we're about out of time in this segment, but how long has this been around? What you mentioned, Tulsa, is it clear back in the turn of the century?
No, well, not really, not in a directed way. So yes, most of the devices that were probably developed more in the Soviet Union, and research started being done on them probably in the late 60s, early 70s.
So it's relatively new on the
It's
scene.
relatively new. Much more known in Europe than it is here, but yes, relatively new.
And is it used in hospitals in Europe?
To some extent. Is it being used in hospitals in the U.S.? To some extent.
Interesting. Well, it is time for that station break. Dr. Pawluk and I will return, so you stay right there. This is Mission Evolution, www.missionevolution.org. This is Mission Evolution, missionevolution.org. So, how does PEMFs work? With us this hour, exploring PEMF therapy is Dr. William Pawluk. His website, drpawluk.com. So, we've been talking about the functionality and how you can use the PEMFs to aid the body, and where EMFs can be very destructive. And so, what formal studies have been done on PEMF therapy?
Well, two aspects to that question. Number one is there are FDA approved machines. So the FDA has approved machines for certain purposes. One of the purposes that FDA has approved machines is for healing fractures that won't heal, called non-union fractures.
Didn't they start that with horses at one point?
No, actually, they were approved for humans 25 years ago or so. So
Okay.
they did start with animals, but no,
Hmm.
they are certainly used in animals. They're certainly used in veterinary medicine. But no, this application was actually studied at I believe it was NYU specifically for human use for fractures that wouldn't heal, because that's a disaster. A fracture that doesn't heal is a disaster. It's not. It becomes an unusable extremity largely. So those were approved back then. So there's plenty of science on that. The Russians, the Eastern Europeans, not just the Russians, but the Eastern Europeans were doing a lot of work back in, as I said, in the 60s and 70s. And they published it. Most of those studies were published in Cyrillic in the journals in the Soviet Union, or again, the Soviet Union countries. So that research really didn't get out into the West to any great extent, except because it was in backwater journals, medical journals. And that's why I published the book along with my co-author, Dr. Jarabek. He was an MD PhD in the Czech Republic. He had translated a lot of that work for his PhD thesis, and his PhD thesis was for how to use PEMF therapies in rehabilitation medicine. So there's plenty of research there, but not, again, well known. They didn't use the same standards. We didn't have the same standards for research back in the early 70s and late 60s that we do now. That was plenty of research there. I have since accumulated about 30,000 abstracts.
What's
Uh,
an abstract?
um, a company that accumulated knowledge and accumulated information.
Okay.
And that's all about how EMFs affect biology, essentially. And we're talking about all kinds of EMFs and PEMFs and so on, and even static magnetic fields. And they can be applied to the body as well to heal. And I still do that to some extent. So I published the book, Power Tools for Health, because the science on PEMF therapy is essentially all over the place. It's very hard to lay your hands on it. It's not like one journal or one body of knowledge. I was the vice president for the North American Academy for Magnetic Field Therapy, because we were trying to build the knowledge base and build an experience base in clinicians, physicians who are doing magnetic field therapies or are interested in it. So there's plenty of research. In my book, Power Tools for Health, I have over 500 references. And in that book, I basically describe the actions of magnetic fields in the body, and I describe 25 actions supported by science, the studies that support those, making those claims for actions, like nitric oxide, like opening blood vessels, like circulation, like healing, like repair and regeneration. And then there are also, I specifically discuss 50 different health conditions, like Parkinson's disease or like MS, and I provide the references for each of those conditions. There's a big section in that book on cancer.
So we're the FDA approved it for healing fractures that wouldn't heal. Is it approved for these other things that you're citing here?
No,
Okay. So
no,
how can we use it if it's not been approved for those things?
it's wellness. It's considered
Well,
wellness. So you
okay.
can't make any claims that it cures cancer. You can't make any claims that it cures pneumonia or head injuries or stroke. You can't make those kinds of claims. What we're doing is we're talking about physiologic functions and the way you can make the body work better.
So is there any action towards getting the FDA to recognize it as treatment for the other things that you've been mentioning?
No.
So we have to kind of go under the radar.
Well, you can read the books. You can go out and do your own research. There are many people selling devices that are making all kinds of interesting claims. So yes, but fortunately, it's extraordinarily safe. So even though they're not FDA approved, you have to understand FDA approval costs a lot of money. A lot of money. It's how to turn a $2 hammer into a $200 hammer. Okay,
Right, but I would think that the approval would go a long ways towards mainstreaming something that works.
no, unfortunately it doesn't, because that's not the way that works.
Okay,
Um,
so
c- comp-
why is the intensity of the PEMF so important?
the intensity is very important because that's what drives the conduction of charge in the body, or the production of charge in the body. That's called Faraday's law. So the magnitude, in other words, the intensity of the magnetic field drives the induction of charge. So if you have a very weak magnetic field, it's going to produce very little charge improvement in the body. If you want to reach deep into a body, you're going to have because magnetic fields are like light and sound and color and so on. They drop off very, very rapidly, called the inverse square law. And because of that, you have to account for the loss of the intensity of the magnetic field if you're going to work deep in the body. So, for example, we have to deliver 15 Gauss for inflammation reduction. The optimal magnetic field intensity for inflammation reduction is 15 Gauss. GAUSS is a term to describe intensity. So if you try to reach across a brain with a magnetic field, you need 15 Gauss to be delivered from one side of the brain to the other. You have to start off with 2,000 Gauss, 4,000 Gauss on one side of the brain to give you 15 on the other side of the brain. So you have to kind of do that calculation when you're deciding what you're going to have to expose the body to and try to help whatever you're trying to help in the body.
Okay, so there's been a TENS unit out for quite some time. TENS. How does that compare to the PEMF?
All right, there's two kinds of electrical reactions in the body, or interactions with the body. There's what I call electrocution. It's in quotes. TENS machine is electrocution. It's introducing charge to the body. It's introducing electrical charge onto the body. You have to use pads that are conductive pads. So TENS machines basically fool the nervous system. They do very, very little healing work because they don't penetrate more than several millimeters into the skin. They don't go deep into the body. And when you're using it for pain management, which is the big topic that we're talking about here today, the problem with pain management is that TENS basically is like stomping on your toe when you have a headache.
So, is the TENS unit approved by the FDA?
Yes, and it requires a prescription.
Interesting. I see they have some TENS units you can purchase on Amazon.
Oh, anywhere. Well,
So
those the
without a
ones
prescription.
purchased on
So
Amazon are extremely low intense intensity electrical fields. Most of the therapeutic magnetic fields that doctors recommend or prescribe, they have to be prescribed by the doctors. You need a prescription for it. So TENS is a completely different attitude in terms of dealing with pain. It doesn't heal. And when I learned acupuncture, that was the problem that I had with acupuncture. It didn't heal. It made you feel better. It helped you with the pain, but it didn't actually heal the tissue. So that's one of the reasons I stopped doing acupuncture, started doing more magnetic field therapy, is because I can now heal the cause of the pain. I
do
don't
you
want to
have
cover it
do
up.
you
I
have
want to heal it.
do you have proof of this, scientific
Yes.
proof?
Oh yeah.
Uh,
There's
and
lots of
studies that are documented?
lots of studies. Power Tools
Okay.
for Health has lots of studies.
Okay. Pretty fascinating. So, what all you were listing some of the things that the PEMFs have been proven to treat and to heal. Would you mention some of those again?
Well, anything requiring circulation. I'll give you an example. And this is not specifically on the topic of pain. I had a 3-year-old child that cut off the end of her thumb
Ouch.
in a door jam, sharp door jam. Fortunately, the father called me before the surgeons did their thing with it, which is normally to clean up the wound and put a graft on it to cover the wound, essentially. They don't expect that it will heal. I had heard stories about people doing therapies in Europe with children before age 11, as long as it's beyond the last joint or the first joint basically. Then you just leave it alone and the body will heal. Well, I'd never seen it happen, but I had a magnetic field put on that girl's thumb, 3-year-old child. 12 weeks later, she's regrown the thumb completely.
Goodness. Now, why did age make a difference?
Um, I don't know why, genetically why. I think we still have some of the capacities that salamanders have to regenerate tissue, but we lose that capacity beyond a certain age. Why that happens, we don't completely understand. But we know that children produce more stem cells. their healing rates are much faster. Their metabolic rates are much faster. So there's a lot. So you compare a 9-year-old or a 3-year-old healing compared to a 70-year-old healing for the same cut.
Can the PEMF mimic a faster metabolic rate?
Well, not mimic, but it can accelerate the metabolic rate slightly. Yes.
Okay, so it's minimal. If it's just slightly, then that's why the young youth factor has to be in there, because they have the other boost, if you will. They have automatically have faster healing, and then the PEMF
Will
increases on that.
accelerate that even more.
Okay,
Right.
that makes
So,
sense.
wounds typically heal in about half the time with PEMF therapy. Fractures can heal often in half the time with PEMF therapy. So, basically, it's giving the body more energy. What we're doing most of the time when you have surgery, when a surgeon cuts you, the surgeon sews you back up again, and then says, "Okay, well, good luck. Come back in 2 weeks, and we'll see what happened." But what does a surgeon do to help you to heal? Nothing. So magnetic field therapy removes some of that chance that you're leaving the body's own capacity and ability. So you're accelerating the body's capacity to heal. You're driving more resources directly to that wound, so the wound will heal faster.
Does this tend to pull from the rest of the body? Does it have an expense?
Well, that's a good question. So if you cut yourself, does that create an expense on the rest of the body?
I know certain, illnesses do, and it kind of seems cumulative. Like, maybe you're dealing with a little bit of a cold, maybe you're dealing with a little bit of stress, et cetera, et cetera. But when you add that one proverbial straw, then the whole system goes
Right.
into stress. I was wondering if you're pulling the attention of the body away to the point that it could be energy expensive.
No, fundamentally, we don't see those kinds of problems. We just see the acceleration. Now, if you have somebody, we've talked about going low and slow. Okay, in that case, if that person who is very depleted, they just spent 2 weeks in ICU, they had a horrible septic episode, had antibiotics, and then ate hospital food for a month, right? When they come out of the hospital, you know that they're very, very, very depleted. And they probably didn't get all the vitamins they should have had. They didn't get all the greens and vegetables that they should have had, etc. So they're now depleted. In that circumstance, yes, it's going to draw resources to healing the wound. But if you break a leg, you better be taking the resources away from somewhere else,
Well, you
right?
automatically do, I would expect,
You
to
have
a
no
certain
choice.
extent.
The body's going to do what it needs to do.
Well, it's time for another station break. Please stay with us as Dr. Pawluk and I continue to explore the possible benefits of pulse electromagnetic field therapy. This is Mission Evolution, www.missionevolution.org.
Are you ready to dive into the mysteries of the unknown? Tune into the electrifying X-Zone radio TV show hosted by the one and only Rob McConnell.
I'm Rob McConnell, and get ready for a mind-bending journey through the unexplained phenomenon that surrounds us all. From UFO encounters to cryptids, ghosts, and everything in between, we've got it covered here in the X-Zone.
Rob McConnell, the seasoned investigator and renowned radio personality, brings you the most compelling interviews with top experts, authors, and experiencers from around the world. Each episode is an unforgettable exploration into the depths of the extraordinary.
That's right, X-Zone Nation. Join me every week as we open the door to the supernatural and explore the strange and amazing stories that will leave you questioning everything you thought you knew.
And it's not just radio anymore. With our groundbreaking TV show, you can now witness the sessions unfold right before your eyes. From chilling reenactments to captivating visuals, prepare yourself for a multimedia experience like never before.
With a legacy spanning over 2 decades, the X-Zone Radio and TV show with yours truly, Rob McConnell, is your ultimate source for mind-blowing entertainment and thought-provoking discussions. Join our growing community of truth seekers as we continue to unlock the world's mysteries.
So, why wait? Step into the X-Zone and embark on a journey that will challenge your beliefs, ignite your curiosity, and keep you on the edge of your seat.
Remember, X Zone Nation, the truth is out there, and it's waiting for you right here on the X Zone Radio and TV show with yours truly, Rob McConnell. Don't miss a minute of the action.
Tune in now on your favorite radio station or visit XZoneRadioTV.com to join the adventure. The X Zone Radio TV show with Rob McConnell, where reality meets the unknown.
The X Zone Radio TV show, unraveling the secrets of the universe, one episode at a time. For more information, visit www.xzoneradiotv.com.
This is Mission Evolution, missionevolution.org. We're continuing our discussion with the author of Supercharge Your Health with PEMF Therapy, Dr. William Pawluk. Dr. Pawluk, share with me a story or two of the worst case that you've seen, where the most challenging thing you've seen come from using this therapy.
Okay, one of the most interesting situations that I got involved in was a gentleman was brought to me to the office when I was still doing holistic medicine by his boss. So he was a supervisor of an apartment building for his boss, and he was in his 50s, and he went to a vascular surgeon, and the vascular surgeon says, we're going to have to amputate both your legs.
Ouch.
And his legs were purple from the knees down. Normally what you do is you press on the skin and you see if there's any blood, right? And you want to see the blood. When you press on the skin, you move away the blood and it should come back. That's called capillary refill. So he was purple from the knees down. And when I saw that as a family physician, that was like emergency. Because at any moment you could wipe out the kidneys, right? They get infection because these limbs can get infected. So he had gangrene from the knees down. And his boss said, do something. And he knew that I did magnetic field therapy. So I put him on supplements. I changed his nutrition, got him off his smoking, got him off his drinking, and got him on a magnetic field. But I really was very reluctant to do that because, he was at great risk of dying quickly, in fact. And I didn't want that to happen on my watch when I was trying to do something that he really needed more drastic attention for. But they convinced me, and I saw him weekly over the next about 2 months. Amazingly, every week that I saw him, more and more capillary returns started to show up. Eventually, he went back to his surgeon and said, this is what I was doing. Do I still need an amputation? And the surgeon said, well, I guess you don't.
Goodness.
So he avoided bilateral below-the-knee amputations by doing nutrition, by avoiding the things that he should be avoiding that could create more of a problem for him, and doing the magnetic field therapy.
And of course, with the three variables, it's hard to tell which did what.
Well, and I don't care.
It worked.
It worked, right? And as a primary care physician, I'm not a researcher. I'm a clinician. And when you go to a doctor, you get everything that you need for that problem. You're going to say, well, I'm going to research on you, and I'm only going to give you one thing, and the rest of you can sort of take care of itself.
Exactly. And I think isn't that the problem with a lot of studies in this and that, is they are unnatural. By the time you get some kind of results, you've isolated things to the point that almost throws a wrench in the works.
Totally. And there's a perfect example. They're called guidelines. Clinicians get given guidelines by authorities and research entities and the Heart Association or the Kidney Association and so on. So in heart failure, the research showed that you should do the following, but the heart failure studies excluded a lot of people. So the results were very, very good for the heart failure patients who were in those studies. But when they got out into the population, it didn't work anymore. Right?
Yes, it's only as good as our knowledge base, right?
If you restricted the people who you treated with those drugs, then they would do well. But nature doesn't follow the rules. It doesn't follow the rules of a study.
So tell me about the biggest flop that you ever had with PEMF.
The biggest flops I have are usually people who just don't follow the rules. who don't use their devices the proper way. They don't use them intensely enough. They're expecting a magic bullet. I use it once or twice and I'm done, right? They want to pop a pill because that's easier than having to lay there on a magnetic pad or use a magnetic pad. So where I see the biggest problems are the people who are the most vulnerable, and they don't have the patience to go low and slow. And
How do you mean most vulnerable? I'm sorry.
sorry.
How do you mean most vulnerable?
Well, say somebody who's got Lyme disease, horrible Lyme disease. They have an autoimmune condition. They're toxic from mold, and they have COVID, or they've had multiple shots. So their bodies are already screaming, and they have limited resources because their bodies are fighting all the time. They're in a constant fight reaction. So when I lay another demand on the body, they have to go low and slow, and they're trying to get results fast. And if I tip the scales a bit too much, then they basically give up. They're in
Okay.
a horrible state of affairs generally anyway, and so almost no matter what you do for them, they're going to be in trouble, and it's going to be a long, 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 long haul.
Because they don't have the resources to heal.
They don't have the resources internally to heal, and they often don't have the financial resources to do the things they should be doing, because the things that medicine has to offer, the drugs and the medications and the procedures that are covered by insurance companies or Medicare, they're not enough. They're often, most of the time, they're band-aids. Medicine has very, very, very few cures. The only cures that we have consistently are infections, bacterial infections. We don't even cure viral infections.
As evidenced by COVID, right? So, when you're doing Reiki, which is an energetic treatment,
Right.
and this sounds like an energetic treatment, even though it's something more easy to measure, the practitioner doesn't necessarily target anything so much as they bring the frequency to the body, and the body takes it where it wants it, where it needs it the most. Is this similar to that?
Somewhat, but not in terms of magnitude. No. Um, I learned healing techniques as well. In fact, I learned Reiki too,
Right.
and
That's why I'm asking. Yes.
I looked at the research on healers and qigong, and what they found is a lot of qigong masters and a lot of qigong healers would actually produce a very powerful magnetic pulse in their
Mhm.
bodies. They had what they call a voltage wall, a copper wall, where they placed their hands on the copper wall, and they did EEGs on them. And what they found is they would produce 1,000,000 volts with a big pulse coming out of their brain into their hands, and then they projected into the environment. They were inconsistent. They couldn't get them to do it every time. So the amount of energy that they were producing is spectacular. So a Reiki practitioner, when you see one Reiki practitioner, you see one Reiki practitioner. They're not all the same. It is energy, and it's often energy produced by the body itself, the healing aspect of it, as opposed to using energy from the universe to heal. Like earthing, often those energy patterns are very low, and so they can be dramatic. What often happens in those healing situations is not that the Reiki practitioner is doing the healing; it's the expectancy of the healee. So the
Like
healee
a
has to believe
placebo.
that is, well, it's not a okay. Call it placebo. I call it expectancy, and I call it basically the person themselves is contributing to their own healing process. Medicine calls it placebo because they don't like that because it's interference. When I give a drug, I don't want you to be messing with yourself with placebo, right? They want to see what the drug is doing. But truly, every 50% of any healing work, anything, any therapy that a doctor gives you, 50% of the benefit of that therapy comes from your own mind, comes through your own placebo effect or expectancy. So actually, hallelujah, I want the more expectancy I can get.
Gotcha. So let the person's belief systems help with the healing.
Critical.
Yeah. Yeah.
If
So
you believe you're not going to be getting well, if you constrict yourself, you're constricting your circulation, right? And
interesting.
you need the
Mhm.
circulation to produce the healing factors to go into the wounds and so on. So emotions can play a huge part in all this. We know that people who are depressed have their immune systems are horribly depressed as well. So that's very important. And if your attitude and your mood is elevated, you stand a much better chance of producing a better healing response.
So Dr. Pavlik, it's about time in the show when I get to ask you, what is your mission?
Um, Good question. I originally went into medicine because I decided not to become a minister or a priest. I thought my mission would be to heal by doing conventional medicine. I could reach more people and be more directed in the healing that I was doing. So healing is a big part of what I do, and teaching people how to take care of themselves. I tell people all the time, I'm not your doctor. You're your doctor. I'm your consultant. I'm going to teach you how to be your own doctor. Because if I don't teach you how to be your own doctor, I'm not there all the time. So you got to be taking care of yourself all the time. So helping people to be healthy and well and live long and prosper. That's my goal.
That's a beautiful goal. So it seems to me, I've certainly witnessed, and I've heard a lot of people complaining lately, that our medical systems are just, particularly since COVID, they're just swamped, overwhelmed. It's hard to even get in and see a physician. Is that accurate, or are we just seeing one side of it?
Well, I think the healthcare system in general is not a system. It's not a coordinated system at all. It's helter skelter. And your primary care doctor, if you go to a primary care doctor, they do what they can do. And then if they can't do it, if you got a heart attack or a heart disease, then they're going to send you a cardiologist. Then your cardiologist is not going to look at your kidneys. So if your kidneys are having trouble as well at the same time, then you need a cardiologist and a kidney specialist. And so it all goes on to a soup of practitioners as well. So it's not coordinated. You have to coordinate it yourself. So I think the healthcare system is really quite broken. It's also lopsided. It's dramatically controlled by institutions. It's dramatically controlled by big money. Pharma is the 15th biggest GDP in the world.
Yeah, that it is. That it is.
Right?
So
So that's controlling system. So basically, it's not doing everything it can do because they want you dependent on their medications.
we are virtually out of time, but what's your vision for the future of medicine?
I think it has to be alternative medicine. I think it has to be complementary and alternative medicine, where you have to combine the best of all of them.
Perfectly understandable. So how do you see this happening? Well, it seems like we've lost Dr. Pawluk. The connection must have been broken. But unfortunately, we're also out of time. I think that it's very important for more studies to be done before we take this hook, line, and sinker. But on the other hand, if it's not damaging, certainly worth looking into. Thank you for being with us on Mission Evolution. And our guest this hour was Dr. Pawluk, William Pawluk, author of Power Tools for Health and Supercharge Your Health with PEMF Therapy. To find out more about Dr. Pawluk and all he has to offer, visit his website, drpawluk.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy our past archives, you can see it all on www.missionevolution.org. But most importantly, please be sure to look us up and join us right here next time, as this mission will continue bringing information, resources, and support to a rapidly evolving world.